Remote nursing mistakes that can ruin your career and how to avoid them. Remote nursing jobs offer flexibility, better work-life balance, and less physical stress, but they also come with hidden pitfalls that can hurt your career if you're not careful. Whether you're new to remote work or a seasoned pro, these common mistakes can lead to burnout, job loss, or missed opportunities. Let's go over the biggest mistakes remote nurses make and how to avoid them. Not setting work-life boundaries. One of the biggest mistakes remote nurses make, letting work take over their personal life. Signs you're blurring boundaries. You're answering emails or reviewing cases after hours. You feel guilty when you take breaks. You're working longer hours than you did at the bedside. How to fix it. Set a clear schedule and stick to it, just like you would in a hospital. Use a separate workspace so work doesn't invade your home life. Turn off notifications after work hours. Your time is valuable. Remote work should give you freedom, not trap you in a cycle of overwork. Protect your time and ignoring career growth and certifications. A common mistake remote nurses make, getting too comfortable. Without a hospital setting, it's easy to stop learning and growing. Why this is dangerous? Remote jobs evolve fast. You could become outdated. Many remote nurses find themselves stuck in low-paying roles because they don't upskill. Employers look for certified professionals. Without credentials, you might lose job opportunities. How to fix it? Stay updated with telehealth, case management, and AI-powered nursing tools. Get high-value certifications like Certified Case Manager, CCM, Certified at Telehealth Nurse, CTN, Legal Nurse Consultant, LNCC, Medical Coding, CPC, CCS. Take online courses on AI in healthcare, documentation, and compliance. The best way to future-proof your career? Keep learning. Poor time management and productivity. Without a supervisor watching you, it's easy to lose track of time or get distracted. Signs of poor time management. You're rushing to finish work at the last minute. You feel overwhelmed because tasks pile up. You constantly get distracted by social media, TV, or household chores. How to fix it? Use time blocking, schedule deep work periods and breaks. Try the Pomodoro technique. Work for 20 minutes, break for 5 minutes. Use productivity apps like Trello, Asana, or Notion to keep track of tasks. Eliminate distractions, set up a dedicated workspace, and mute non-work notifications. Your success as a remote nurse depends on how well you manage your time. Lack of communication with your team. Just because you work remotely doesn't mean you should disappear. Many nurses struggle with feeling disconnected from their team. Why this is a problem: poor communication can lead to mistakes in patient care. You may miss out on promotions because leadership doesn't see your contributions. You might feel isolated and out of the loop. How to fix it? Check in regularly with your team via Slack, Zoom, or email. Be proactive. Ask questions, offer insights, and stay involved in discussions. Join work-related chat groups to maintain relationships with coworkers. Remote work doesn't mean working alone. Staying connected helps your career. Not keeping up with technology and AI. In nursing, AI and automation are changing everything in healthcare, including remote nursing. If you're not keeping up, you risk falling behind. Why this is a problem: employers prefer nurses who can adapt to new technologies. Many manual tasks are being replaced by AI tools. Nurses who don't embrace tech might find fewer job opportunities. How to fix it? Learn AI-powered nursing tools like Nuance Stacks, Epic AI, and telehealth platforms. Take online courses on AI and healthcare. Many are free on Coursera and edX. Follow health tech news to stay informed about changes in the industry. AI won't replace nurses, but nurses who use AI will replace those who don't. Stay ahead. Then thinking all remote jobs are easy. A huge misconception that remote nursing is less demanding than bedside nursing. Reality check. Remote jobs still have high workloads, just different stressors. You may deal with tight deadlines, strict documentation requirements, and constant audits. Some remote jobs track your productivity. You're still being monitored. How to fix it? Be realistic. Remote work is different, not necessarily easier. Develop good documentation and workflow habits to stay efficient. Find stress management strategies to handle the mental workload. Remote nursing isn't a vacation, it's still a job. Set realistic expectations. Staying in a job you hate just because it's remote. Some nurses stick with toxic remote jobs because they don't want to go back to bedside nursing. Why this is a problem: a bad work environment still affects your mental health, even at home. You may be underpaid or overworked without realizing there are better options. Feeling stuck leads to burnout, even in remote roles. How to fix it: know your worth, research salaries for your role, explore other remote nursing options, case management, utilization review, telehealth, insurance appeals, and more. Network with other remote nurses to find better job opportunities. You deserve a job that values you. If you're unhappy, you can find something better. Final thoughts: make remote nursing work for you. Remote nursing can be a great career move, but only if you avoid these common mistakes. Quick recap: set clear work life boundaries. Don't let work take over your life. Keep learning and getting certifications. Stay competitive. Master time management. Stay productive without burning out. Communicate with your team. Don't isolate yourself. Stay tech savvy. AI is changing healthcare. Be realistic. Remote nursing is different, not always easier. Don't stay in a bad job just because it's remote. Remote work should improve your life, not make it harder. Avoid these mistakes, and you'll have a successful and rewarding career. Which mistake do you think is the biggest problem for remote nurses? Drop your thoughts in the comments. Don't forget to like, subscribe, and turn on notifications so you never miss tips on remote nursing, career growth, and self-care. See you in the next video.